Welcome to Transform Now, the podcast brought to you by SS&C Blue Prism. Agentic automation isn't just the next step in automation, it's the future of how work gets done. By enabling intelligent, autonomous agents to take action, adapt, and collaborate, organizations are unlocking new levels of productivity, growth, and customer delight. Join us as we explore how agentic automation is reshaping work for the better, for customers, employees, shareholders, and most importantly, you. To stay on top of the hottest topics in the world of agentic automation, subscribe now. Let's get into the show.
Hello, everyone. Brad Hairston here. Welcome to Transform Now. My guest today is Jesse Tutt, Program Director of Intelligent Automation at Alberta Health Services. Jesse has been on the podcast before, and he and his team have been recognized multiple times by SS&C Blue Prism for all the great things they have done for their healthcare system. Jesse, welcome back, my friend. Why don't you tell everyone a little bit about yourself as we get started?
Thanks, Brad. I've been working in IT for a couple decades now, and I'm a serial entrepreneur. I do certainly some public speaking, and my passion is certainly intelligent automation. And so going through and automating manual processes is my specialty.
Fantastic. So, Jesse, I mentioned you and your team have been recognized. This includes the SS&C Blue Prism Legend Award, which you guys got last year and in 2024. That's a really high honor. It's kind of our version of the Hollywood Walk of Fame. What originally drew you into this field, and what keeps you motivated today to do the same thing?
Sure. My background was operations. I moved into a role that was largely focused on analytical reporting. I created a whole series of probably 200, my team did rather, 200 different dashboards. And we identified a whole bunch of different gaps. And ultimately, when we reached out to the different service owners and the different business owners, they said, all right, well, we agree this is a gap. It's certainly pressing, but we don't have the resources. And so we ended up investing in robotic process automation. And that was kind of the launch pad for us taking off, and then adding certainly a collection of technologies around that. But the foundation was that quick conversation that I ultimately had with the current CIO that said, hey, how can we help here? And that was the way to help. And, from a back end perspective, looking at dashboards and seeing these things, and it's a completely different field of being able to offer a service that both identifies those gaps, and then secondly, it helps to address the issue. So that was kind of a bit of background on how I got into it.
Yeah, got it. Well, your team has saved Alberta Health millions of dollars and thousands of staff hours. In fact, I love on your LinkedIn profile, under the description, it says 260 years automated. It's quite a bit. That's very impressive. How do you measure the human impact of automation in healthcare beyond the dollars and the hours saved?
Absolutely. And we have basically 49 automations that are in production now. And all of them, we track the actual business benefit down to the minute, because we record the manual process that we're automating, and we know how many times that we've run the automation. The challenge is, to your point, the business facing or the customer side. And the answer is it's huge, probably double or triple what the actual business benefit is, because in many cases, we're working with shared services that offer service delivery to patients, and for the most part, all of them. And so the answer is we've got some real use cases that are providing major, direct clinical benefit and business benefit. And of course, as an organization of our scale, we have business units that provide every function. And so, we've got, hundreds of thousands of that. Well, really, we have 130,000 people that work for us, but we also have another 80,000 or so people that use our systems. And so it's a large organization, and we have companies within our company that basically do every function, and we've automated in almost every function. So we have, both internal benefit shared services, and then we also have the business facing stuff. But the business facing stuff, we've automated work in the point of sale stores that we have, because we operate food stores. restaurants really. And then we also offer gift stores. And so it's interesting that the benefit is widespread, but we've had a pretty big impact.
Yeah, beautiful. Jesse, what are a few of the key guiding principles that have really helped your team have so much success with automation?
Action, and ultimately getting the automations implemented as soon as possible. So the whole notion of agile and getting the work in as soon as possible to provide business benefit, I think is the foundation. Far too often, and I've worked in waterfall projects, and the short answer is when you have complexity at the scale that large organizations do, both political and just pure systems and all these other things, we have, let's just say 1,300 enterprise apps, and integrating them and all these other things, you have to move quickly or else things will last years. So we've built a collection of reusable code, which I think is the one piece that has allowed us to act very quickly. But the urgency is the foundation where when you've got 20 or 30 people in a meeting, you need to have a sense of urgency or things won't happen. So that would be the foundation, I would say.
Yeah, got it. Great stuff. So Jesse, the last time we talked, I think generative AI was not really mainstream as much as it is now. It was on the radar. Companies were beginning to explore it. And I think that was the same for your team. Now I know you've actually done a lot more with Gen AI and you continue to think of additional ways that you can leverage it. Can you share an example of where you've augmented your digital workers with Gen AI and the difference that it's making?
Sure. We've got 3 buckets of Gen AI kind of automations right now. We've got obviously chatbots. We built a chatbot that allows a specific team that we've indexed all the knowledge and then allowed them to actually chat with their knowledge. And so I think every organization plays around with chatbots. And so I'm not going to speak to that because I think it's extremely easy, days of work, and foundationally doesn't solve, it solves a business problem, but the business problem isn't one that that will benefit everyone in the organization. The second one is certainly document intelligence, where we are using a whole series of different APIs to figure out what the heck's in documents. Now, the solutions that we're using do involve LLMs because naturally, once you've got the data out and the key value pairs, you need to understand them. And so that has been really, really beneficial. We've got a whole series of automations that we're working on right now that will extract data from largely faxes. It's surprising. I'm sure everyone would be wondering why we even have faxes, and I did as well. But we have thousands of fax machines. And so this problem of people picking up faxes and then putting them into enterprise systems, every organization has it, and in full acknowledgement we do. And so the business process to actually take those at an enterprise scale and connect in an automation that would allow us to actually scan documents from thousands of fax machines, pull them using a robotic process automation, pull them into a website, have end users validate it. Once the data has been extracted by AI, then push it into the enterprise system is it's a focus. One of my top focuses. The return on investment is insane. So that's the second one. And then the last one is certainly just using all these LLMs to basically understand unstructured data. So my favorite one is an automation that we've built that looks at knee MRI requests, which is a procedure that happens to your knee if you've hurt your knee badly. And we have very rigid criteria for when these are appropriate. And when they're not appropriate, they don't provide clinical benefit. And the challenge is if you process somebody that needs these things, there's a delay, typically weeks, months, that is impacting people. You have to get them out of their job and get them in this procedure. Then you have to take up clinical capacity, which is expensive. And so the short answer is you don't want to do things that you don't need to do. And basically with these LLMs, we now are able to actually look at these requests and actually use LLMs to figure out, do they meet this criteria? Did they meet this criteria? And we have 15 different criteria in our organization. And the outcome is, a 10+% reduction potential for these procedures. Huge. Wow. And that's just one modality and one example, but potentially, there's a lot of clinical processes that happen, as everyone knows, that potentially may not necessarily be needed. And it's not like there's a specific person on your care journey that knows and contemplates everything, because these systems are sometimes disparate. And secondly, maybe your care is provided by different people. And so the answer is, by using AI, you can very quickly rationalize, turn a big, massive page of data into a few summaries or into structured data. Give me a 1 for yes, give me a 2 for this, give me a 3 for this. And that is literally what we're doing. And so that it's a single prompt that's maybe a page long, but we're talking millions. Yeah.
That is such a great use case. I'm thinking about just so many different examples I have of, tests or MRIs or other things that myself or my family or others have gone through that turned out to be, overkill in a lot of, scenarios. And boy, so much expense and time, wasted time, and effort could be avoided by putting a little logic against, each individual situation. So I think that's a fascinating use case that you guys have implemented there. And I'm sure that's going to spark additional ones just like it. Jesse, as you get into Gen AI, prompt engineering comes up a lot, and there really is skill to it. And it's important not only for individuals that are prompting large language models like you or I messing around with ChatGPT, but when you have digital workers now that are going to large language models and they're asking it to respond, for example, to a criteria. Is this person meeting this criteria? Do you guys focus a lot of time and effort on prompt engineering as a discipline? Is that something that has been a big focus for your team?
I'm just coming off of 2 weeks of basically effectively prompt training, literally as I just attended.
Oh, I get the answer. Yeah.
From the government of Alberta, which was exceptional.
Okay. Yeah.
Kudos to Janek for that. But the Alfred, who's our deputy minister in one of our ministries. Anyways, the point is that it's exceptionally important, and probably the number one skill that I think every organization from top to bottom needs to learn. So I've been providing a whole series of prompt engineering training sessions to both leaders, staff, and then managers. Usually there's kind of 3 groups, and then by discipline. And so, I met with a group of lawyers a couple of weeks ago and did a whole series of prompt engineering exercises. And it's remarkable to be able to upload a contract, upload a second contract, and what's the difference? What's the top 10 risks, or maybe draft a briefing note. And so, or draft a PowerPoint presentation. And so, and as to your point, there's kind of the human prompt engineering piece, and then there's the automated prompt engineering. Ultimately, every single automation that we have, we've been fighting and working diligently on this. Effectively, when you do a mammography procedure, they have a whole series of different things that ultimately spit out a criteria and a score for if you have breast cancer. Pretty important. And as a woman, and so as you go through these types of things, the answer is the prompt engineering is the foundation. And you can have a good test data, you can have a not good automation, but you need to figure out how to understand and structure unstructured data. You can only do that with a prompt these days. And so everyone, I always giggle just about how people have an assumption that sometimes you can code and build code to actually do things, but you need LLMs. Like they understand language better than any of us. So I
have found, and I'm sure you have as well, that the prompts themselves can be very complex if you're going to get the best result. Sometimes digital workers are the best medium to make those kind of prompts because they can do them at scale. They can do them right every single time. Whereas humans, we're going to struggle to put that kind of, prompt together, consistently and, to do it from scratch in many cases. So it's possibly one way that digital workers can help us consume large language models and the benefit there more at scale. Jesse, as your team now starts to integrate Gen AI and do more and more innovative things, how do you balance the speed of innovation with the need for rigorous, compliance in such a regulated environment like healthcare?
Certainly it adds a bit of extra work. And so, specifically around Gen AI and all these LLMs that are out there, most people don't realize that they deprecate in a very short period of time. You've got like an 18-month window from the point that they launch it to the point that it's gone. And then the next one comes upon us which may or may not provide the same result. The answer is it won't. And so each model now, we have to build in not just the process of doing full UAT testing on every single new implementation, the new automation, but at the same time that we're building that automation, we have to think about how are we going to operationalize this and test it in 18 months when the new model comes out.
Right.
So as an example, with regard to that document intelligence automation, all of our documents as the data is extracted from the LLM, and we basically put it into a database, and then we are keeping intentionally all of our faxes and all the data that was extracted from it. And then secondly, the human validated data, so that we've got an ability to actually compare the result to the prior LLM. And secondly, compare it against what is actual reality, which is loosely the human version, which, humans make mistakes. But the point is that we've got a gold standard for that. So that's a bit of the logic we've been thinking through, but it's new ground. And I think new procedures need to be, and guidelines need to be developed. But the answer is it's no different than any other SDLC process. If you launch new, you have to test it. And so, but the difference is the impact because of the scale of these automations. You can't have them down. So I think that's the key point is, make sure you give yourself plenty of time. And if you got 18 months for a window, maybe you should start testing at least, 6 months prior to the next model.
Okay. Let me change gears here a little bit and hit you with a kind of a more philosophical question. How has working in healthcare automation changed you personally, the way you see people, systems, or even technology itself?
Healthcare is inherently risk adverse, and for good reason. They don't want people to die. And so the ability to personally, what I've been learning has certainly been a 20-year lesson on ProSci and organizational change management, and which is the foundation of an intelligent automation team. It's not the tech. The tech's actually easy. It's not, all of these different solutions, which I think for most purposes, any IT team can pick up. The barrier is, having a good sponsor, having, finding out your resistors and then working through how to make them aware and build some desire and ultimately get them on board, and then do that quickly. Really quickly, so you can actually show some progress. That's my biggest takeaway is doing presentations and building awareness and reaching out to people directly. And it's difficult, but that's the primary role, I think, of a automation leader these days.
Yeah. That makes sense. Another interesting thing going on in society and all the studies that have been done about large language models, how people are using them, are starting to say that people are using them as advisors, as friends, as companions, and certainly, for healthcare advice. In fact, I noticed when OpenAI released GPT-5, one of the things they touted when they did that was GPT-5 is our best model yet in terms of diagnosing medical issues or, providing advice to people. So this obviously can be kind of provocative, and I'm sure the healthcare industry in general doesn't want to see doctors get replaced by machines or anything like that. But what are your thoughts on how this is evolving and where this might go?
The answer is, some people can't get access to care, and these models are starting to fill that gap. The second part of it is that physicians go through an extreme amount of training, and a lot of the stuff that these LLMs are trained on isn't true. You know what I mean? It's just opinion. And so, you look at the the primary source for most LLMs is Reddit and all these other sources that are opinion and having a bit of a digital marketing background and working with companies that have manipulated the end result in these LLMs. They are fickle. So I always take it back to that, how do you make dough more sticky? You add glue was the result for a long period of time. And the reason was because on Reddit, that was the top voted response. And LLMs don't realize that it's a joke. And so the answer is extreme caution and to basically take things and hopefully get some advice from humans. But the foundation of it is a human-centered approach where AI is an extremely valuable tool that can provide extremely good recommendations, bounce it off a human after.
Yeah. I bet if we took a poll, almost every single one of us at one point or another has asked a large language model a medical question about something going on with us or our family or what have you. I bet that's one of the most common things that happens every single day. Jesse, another area that is bearing down on the automation sector as a whole, and I know healthcare is, may not be quite as aggressive on this front, but I'm curious about your thoughts on the whole agentic automation movement. This idea that you not only integrate AI with your task-based agents and make them more capable, but then you start to give them certain levels of autonomy and self-direction. And so they can perform a role the same way that maybe a human would play that role and do it with less human oversight. Have you seen any interest at all in that type of capability there at AHS or among your colleagues or others that you know in the industry?
The government and Alberta Health Services have all been obviously looking into agentic AI in its early stages. There's a ton of early adopters that are using ChatGPT with agentic and Manus and all these other tools on a personal agentic AI side. On the automation side, I have not, but for predominant for firm, everything that we use, it's resilient, data centers and city resilient. And then we also have resiliency typically just because the scale of and the type of work that we do can't be done. It has to be on-prem. And by on-prem, I mean connected to our network, whether it's private cloud, that's also fine because we have we're a Canadian government entity. We have to have our data in Canada in a data center, at least at a high level for the purposes that I'm using it for, which is patient care and employee data. And so the answer is, I think it's going to really start taking off. We have looked at doing, piloting a few different agentic AI tools that are actually able to be hosted. And certainly I've looked into N8N and all these other tools and Manus I use daily for the most part. I've found just as the past few months, the accuracy of it and the ability for it to do full agentic has really been impressive. But at enterprise grade, I haven't found a lot of solutions that are enterprise grade yet. And I think there's opportunity. And as time progresses, it's going to come. Yeah.
Okay. Jesse, I want to wrap up with you by just talking about something that is, I think, unique about you and your team, and it's something that you've been recognized for and awarded, recognition for, and that is the fact that you and your team have always desired to share your learnings with the broader automation community. You really enjoy doing that. I've seen you do that on many occasions, and I see you continue to do that. Could you just talk about why that's important and why that's kind of part of the DNA of your team?
Part of it is organizational culture where we're government. And ultimately, I think there's a mentality that the work that we do is not ours, that it's taxpayer funded. So at that level, I'm fully open to share code and our architectures and our experiences with anyone, both in Canada and outside of Canada. And certainly number two, the work that we're doing for me is actually the right thing to do. Meaning that we all are facing economic challenges. Secondly, there's so much fiscal constraint across the world that inevitably services are not being provided because we don't have the funding. And for me, automation is the only option to fill that gap. And so every organization that can basically take work that is manual, that is boring, that people hate doing, and automating it, and then taking that capacity and repurposing it to actually work on demand and attack the backlog and provide better customer service and increase employee satisfaction. And it's the right thing to do. And so there's kind of, that would be the other piece where I think all of us need to step up our game and be more sharing and hopefully learn more lessons. And the only way we can do that is by having conversation with each other.
Yeah, there's no other perfect way to put it than that. So that's really great. Thank you for sharing that. Well, Jesse, it's always a pleasure having you on, and I really appreciate you giving us some time today just to catch up with you and hear about some of the really exciting things that are going on. And thank you for joining, and I wish you the very best.
Thank you, Brad.
Thanks for listening to Transform Now, the podcast from SS&C Blue Prism. You can find all of our episodes on your favorite podcast channel, as well as YouTube. To stay on top of the hottest topics in the world of agentic automation, subscribe now. The future of work is here.